Hello, welcome to the CIRS Healing Collective Expert Guest Video Series. I'm Jenny Johnson, the host and facilitator of the CIRS Healing Collective, which has been a resource for aspiring CIRS overcomers to share and connect from around the world since 2020. I'm a Shoemaker Proficiency Partner and CIRS coach, and most importantly, an overcomer myself. What you're about to see is a 10-minute excerpt from a 90-minute group discussion that members of the CIRS Healing Collective got to have live with this expert guest. If you would like to see the full 90-minute replay, come on over to the CIRS Healing Collective. We have a robust video library from the past 5 or 6 years of so many expert guests. Better yet, you'll be able to join our future monthly live discussions with experts to come. We'd love to have you. And I'm going to read a formal bio so that we can appreciate Dr. Ditulio's background even more. So I'm going to look over here because I have it pulled up on another screen. Dr. Ditulio is a certified clinician in the Shoemaker Protocol for CIRS. Having worked with over 1,000 CIRS patients, over the past 8 years, she understands the nuances of the symptoms that each patient presents with CIRS. CIRS is triggered by many different biotoxins, water-damaged buildings being the most common, but also tick-borne diseases, metals accumulations, and even viruses. In turn, CIRS can trigger downstream illnesses such as leaky gut syndrome, mast cell activation syndrome, SIBO, and dementia, just to name a few. Dr. Ditulio is also trained in the Bredesen Protocol as a RECODE 2.0 clinician treating Alzheimer's and other forms of dementia afflicting patients. For those of you who don't know about this, there's a lot of correlation between toxin exposures, specifically biotoxins, in addition to metals and other things, but biotoxins and Alzheimer's. And so Dr. Bredesen's work in reversing and preventing Alzheimer's is closely connected with Dr. Shoemaker's work. And Dr. Ditulio is a bridge there, which is fantastic.
One of the things I like to lead with is that even though people are appropriately concerned about all of these things, I often encourage the fear factor to try to manage the fear factor, because in terms of tick-borne illnesses, many times people will become very, fearful that they're going to be sick forever, or in terms of the mold illness, that this is going to go on forever. I would reassure you that I've been doing this for, 28 years in my primary care practice, and we have big toolboxes for each of these arenas. And we have approaches, and despite the challenge and the fact that people often don't feel well, it's our job to help you maneuver through the challenge of sorting out what the different issues are that you might have. I will say that the way that I treated Lyme disease and the co-infections 20 years ago is quite different than how I approach it today. And because today, I understand that many of the people who are experiencing these infections are also impacted from water damaged buildings. And it is the great duo to have both. And it's, in my opinion, one of the reasons why so many people are treated extensively and long-term for infections that don't seem to get better. And that is usually because underlying that person's immune system is complete dysregulation from another toxic exposure. If mold is part of the equation, then I'm going to approach the mold first to organize the immune system better. So the other tick-borne infections, right? Ticks are little stealth bombers. We have Babesia and Bartonella, Mycoplasma, Anaplasma ehrlichia, Rocky Mountain spotted fever. Now there are viruses that have been identified that are carried on ticks. So we do have a smorgasbord of different infections. But again, it doesn't have to be overwhelming because once you, if the mold is an issue, if CIRS is an issue, once you fix the mold, then it's going to be quite clear what symptoms are left that aren't mold related. And now you have a symptom profile that's easier to identify a particular tick-borne infection. So for example, Babesia classically has night sweats associated with it. Well, so does mold. So, you can't really, sometimes you can't tell just by the symptom. So you fix the mold and the night sweats go away. And if they return, then you have to question whether or not the immune system now can see the Babesia better. And now the night sweats are back because that infection was present all along. So Babesia, night sweats, air hunger, headache, and fatigue. But the challenging thing for the clinician is that the symptoms of tick-borne illnesses, particularly Lyme, and the symptoms of CIRS are pretty much the same, all doable. So I definitely approach CIRS before I try to approach any kind of tick-borne illness. Now, I do test for Lyme with every set of labs that I do. So the CIRS labs that I do every 2 to 3 months. A Lyme Western blot, just a classic Lyme Western blot is every time. And this makes perfect sense based on what I've already said, because as the immune system improves, you're likely to see more antibodies show up on that Western blot if the person has an underlying infection. Because one of the problems, as you know, with antibody testing is that if the immune system is suppressed or disorganized, you're not going to get an antibody response at a level that's going to be positive from a LabCorp or a Quest, for sure. Those have to be 80% of control before that antibody band will ever be reported out. So if your immune system is not organized enough to get to 80% of control, but you're at 40% of control, then that antibody is not going to show up. So, but over time, yes, you will see changes in the Western blot that will give you clues. If infections are detected, they definitely need to be treated. The CIRS protocol will help to clear the die-off from the treatment, but it definitely, they need to be treated separately in some manner. But we don't, even in primary, we don't approach 5 different things on the list at the same time as possibilities, right? We start with the one that's most likely and most impactful to the person's functional status. Okay, what is the most important thing here to get this person back to a better place?
What are some of the symptoms that would clue you into, oh goodness, this may very well be a tick-borne illness or Lyme? I know you shared some that had some crossover with CIRS, but what are some of the unique ones that might indicate Lyme to you?
Yeah, so that's a great question. So with Lyme, joint pain is so classically Lyme. And we know that in particular, the knees. So if somebody comes and they don't, they say, my joints hurt, and I say, which joints hurt? And are they consistently uncomfortable or are they intermittently uncomfortable? And they say, well, yes, intermittently different joints, but my knees really bother me. That's I'm already now going to put Lyme at a higher level on that differential list because of that. And it doesn't mean that you can't have Lyme without knee pain, but if you have knee pain like that, it's very commonly associated with. So that definitely would be the most classic. I mean, things like fatigue and cognitive impairment and myalgias and just feeling globally poorly can be associated with, of course, CIRS or tick-borne illnesses.